Sorry about that, but these inherited disorders increase the risk of venous thromboembolism, including CRVO. Genetic mutations like prothrombin, the mutation in prothrombin, or elevated homocysteine levels due to MTHFR mutations may also play a role. So CRVO can't be inherited, but things factoring CRVO in the coagulation aspect you can inherit. Common coagulation tests in CRVO, routine coagulation tests like PT and APTT are typically normal in CRVO unless there's an underlying systematic issue. Um, an elevated D dimer is often seen, including activated clot formation and breakdown. Fibrinogen levels may also be elevated, reflecting the reflecting the hypercoagulate, the hypercoagulability state. Specialized coagulation tests in CRVO. Specialized tests help identify hypercoagulability states in CRVO. These include measuring factor 8, WFV, VWF, and fibrinogen levels. Generic test for factor 5, latent and prothrombin mutation G20210A are essential in younger patients. Test for protein C, protein S, and anti-phospholipid antibodies further identify underlying risk. Other tests relevant to CRVO beyond coagulation tests, other labs can pinpoint systematic risk, a lipid profile detection can detect hyperlipemia. I might have butchered that, but HbA1c reveals poorly controlled diabetes. CBC may show elevated platelets and a high hematocrit. Um, Homocysteine levels and inflammatory markers like ESR may also provide clues. Populations infected by CRVO. Who's affected? Most individuals over 50. Um, the gender is slightly male predominant in some studies. No ethnicity strongly is reported. Risk groups would be people that are diabetic or hypertensive, people in hypo um, coagulate, coagulable states, hypercoagulable states like factor 5 and pregnancy, and smokers, which would increase the vascular and clotting risk. How is CRVO treated? CRVO treatment focuses on addressing underlying causes and restoring blood flow. Anti-VEGF injections are steroids are induced to reduce molecular edema and inflammation. Anticoagulants like heparin manages systematic hypercoagulability, while laser therapy helps um, neovascular complications. Some interesting tidbits about CRVO. would be it was recognized in the late 1800s, and it was a link to hypertension. Some notable cases in younger patients. A study in 1990 highlighted CRVO cases in young adults. Factor V mutations um, developed in patients as young as 22, rarely detected in adolescents. At 30 years old, an athlete, after prolonged dehydration due to intense training, triggered hypercoagulability. And a rare pediatric case, 16-year-old was diagnosed with CRVO after later finding that he had an antiphospholipid syndrome. Some weird test results was there was cases where the D dimer came back disproportionate, even with absence of systematic clotting symptoms. Some patients with CRVO exhibited unusual markers. And some fun facts: CRVO is a stroke warning, and CRVO in space travel. An astronaut found microvascular changes in the retina. So that's pretty cool. A cultural note: in late 20th century, a famous chess player lost vision due to one eye. Wait, he a famous chess player temporarily lost their vision in one eye due to CRVO. So quiz time. Let's take out a piece of paper and something to write with. Alrighty. Which of the following coagulation factors is commonly elevated in CRVO, contributing to hypercoagulability? Oops, sorry. Oops. That would be factor 8. So C, factor 8. Factor 8 plays a major role in the coagulation cascade, so its elevated levels in CRVO can contribute to a higher risk of clot formation, blocking the central retinal vein. Imp- Impaired fibrinolysis in CRVO is often caused by which of the following inhibitors? That would be C, PAI1. PAI1 inhibits the breakdown of fibrin clots, leading to prolonged clot presence in CRVO. This contributes to vein blockage and retinal damage. Which genetic mutation is commonly associated with hypercoagulability states in CRVO? And that would be B, factor V mutation. The factor V mutation makes factor V resistance to inactivability by protein C, leading to increased clot formation. It is a major genetic risk to CRVO. Which role does von Willebrand factor play in the pathogenesis of CRVO? A. Sorry, I kind of rushed that one, but it'll be A, guys. It promotes platelet adhesion and agation. But again, it'll be A. It promotes platelet adhesion and aggregation. VWF helps platelets stick to damaged vessel walls, initiating primary hemostasis in CRVO. High VWF levels contribute to clotlet formation. Five, which of the following is not typically associated with CRVO related hypercoagulability? And that would be C, decreased D dimer levels. So typically in CRVO, D dimer is increased or elevated as they indicate active clot formation and breakdown. This decreased levels would not align with CRVO pathology. And here are my references. Thank you very much.